Hello, I'm Danielle Tantone. I'm a nurse, author, coach, and a Medicare consultant. And I'm coming to you in late September 2025 talking about the upcoming changes for Medicare 2026. As you may know, AEP starts October 15th. It runs from October 15th through December 7th. And AEP is the annual enrollment period for Medicare. So this is the time when anyone can make changes. You're going to see a ton of ads on TV, people making you feel like you are definitely on the wrong plan and need to call their 800 number right away so they can get you on the right plan and you can save thousands of dollars and all of these things. I want you to just take a breath because chances are you're on a fine plan. Your plan isn't disappearing. Chances are your plan may be disappearing. And if that's the case, then we'll find the next best plan for you. I'll take to step back for just a minute. As you may or may not know, when you sign up for Medicare, you sign up for Original Medicare, which is Part A and Part B, through the Social Security website or through a Social Security office. And then to that, you add either a Medicare supplement or a Medigap plan, same thing. And that might be called Plan G. It might be through any one of the independent insurance carriers. And then you add a drug plan with that. Or you went down a different path and you signed up for a Medicare Advantage plan. Now, neither option is bad. Both are actually way better coverage than you've ever had in your life before you turned 65 for way less money than you've ever paid in your life for that coverage. So they're both amazing. In fact, most of my clients have chosen Medicare Advantage plans. And I really try not to recommend any one path. I explain how they both work, and that's been what most of my clients have chosen. I personally do actually think that Medicare Advantage plans are great, and that hasn't changed. A lot of agents and financial planners don't understand the Advantage plans or just personally feel that if you can afford a supplement, it's better. We can talk about that. And in my opinion, it's not better or worse. It's basically just a different way of covering yourself. I actually am writing a book about this, and in my book, I use the analogy of like if you were building a house, the Medicare supplement is like a custom-built house, and the Medicare Advantage is like a spec home. So with the Medicare Advantage, it's all packaged together. It's already created for you. You don't have to make quite as many choices. You don't have to pay quite as much money, but you don't, it's all prepackaged. Whereas the Medicare supplement, each thing is separate. You choose, who you want to build your walls, who you want to put in your electric, who you want. So that's my little analogy. I do it a little bit more eloquently in the book, and that's coming up soon. But just to give you an idea that neither one is bad. They both can be amazing. And a lot of times these Advantage plans, especially in the past, have given you way more bang for the buck, way more wellness benefits, dental and vision and a gym membership that are, I think, just as important as the sick care, coverage when you get sick. We all need that, of course. And every plan has that. Where the Advantage plans excelled was in this well care, which I think is just as important, if not more so. I think that it contributes to your overall health and longevity in ways that you don't even understand, we don't even think about. So like dental, for example, my mom was a dental hygienist for 50 years. And so I learned at a young age that dental hygiene is not just about looking good. It's directly connected with your cardiovascular health, with your overall health, basically. So anyway, not to get on a soapbox about that, but the point is, if you've been on an Advantage plan, your plan may be going away this year. There's a lot of contraction happening in that market. They're like consolidating plans. In the past, I've looked at the plans and there's been like, in my county, 60 or 70 different Advantage plans at any one time. I mean, that's a lot. And the vast majority of them are super similar. Like even one company might have 3 different PPO plans and 5 different HMO plans. And it was quite confusing, when many of the benefits were very, very close. And it was honestly kind of hard to even select a plan. So what I was helping my clients do is just kind of almost like a process of elimination versus a process of selection. So just kind of guiding them. And frankly, I would pick a couple great plans that made sense for most people. And most of my clients were on a couple different plans, not because I was trying to steer them toward anything, but because, I can't be an expert in 70 different plans any more than you can. And I just picked a couple that really made sense for most people. And then if I had somebody who had a special case and who those plans didn't work for, then we'd look at some other plans. I am an independent agent. I am contracted with a few different companies. I choose not to make it too broad because frankly, I only have so much time. And like I said, I most of the plans are very similar, and I've looked at other companies and I've found that these couple companies offer a good selection and good benefits. And if ever that changes, I'm very fluid. And several years ago, I had a client who really wanted to be with one company, actually a potential client. She wasn't yet a client. And so I went and got contracted with that company for her because I've had clients who live in a state where I wasn't yet licensed, and I've gone and got my license in that state. So I'm super flexible. But I also, if you don't have a specific need, I generally have leaned toward a couple different plans. Now that said, one of the plans that a lot of my clients were on 5 or 6 years ago is now going away. So when that happens, don't panic. It just means that you have a new opportunity to pick something new. You have an opportunity to pivot. Now, you have a special opportunity to get guaranteed issue into a supplement. And that may be a really good option for you. We can sit down and talk about that. A lot of agents and financial gurus really prefer supplements because they offer you ultimate flexibility. Basically, they piggyback on Medicare. So you can go to any doctor anywhere in the country that takes Medicare, and it just piggybacks. So there's no networks to be concerned with, no insurance pre-authorization or anything like that. It's just original Medicare with a supplement to pay for that, to supplement the gaps, basically. That's why it's also called a Medigap plan. So you have a special opportunity to get into that for a guaranteed issue. Now, these supplements, though, have a monthly premium, whereas the Medicare Advantage plans generally don't. So that's something that we can weigh. We can look at, does this make sense? We'll look at what that premium is going to be for you and whether it makes sense. One thing to know about the supplements, as a reminder, is that a Plan G is a Plan G is a Plan G. So, for example, the coverage is going to be the same no matter which company you go through. The difference is going to be the price, and sometimes some of the wellness extras might be different. So we can definitely look at that. So that's a special opportunity. And then another option is going to a different PPO, because there might still be a PPO offered, or you may want to rethink the HMO. For the last few years, I've been moving a few of my clients over to HMOs because they, in the past, HMOs can be really restrictive and annoying, frankly. Frankly, you need to get pre-authorization from the company for everything. You need to get pre-approval or a referral from your primary care physician, which can be a pain. So most of my clients who were young, only 65, and just coming on Medicare, relatively healthy, they didn't want to be bogged down by that. They wanted to have maximum freedom and flexibility. And so most of them who chose an Advantage plan chose a PPO because that's what they were used to, while they were working, and that just felt more free and flexible. But what they've found over and over again is that even by going with the HMO, if the network still includes all of their doctors, then it still can be a great option. You just don't have the out-of-network coverage. So it's something to think about as well. So if your plan is going away, then we definitely need to meet. We should talk about that. If you're already a client, just set up a meeting on my calendar. If you're not already a client and maybe you either don't have an agent or you haven't heard from your agent in years, or, you don't like them, or you just want to change, also feel free to go on my calendar. There's no cost or obligation for this. When and if I help you select a new plan, I automatically become your agent. So I'm happy to meet with you whether you are or are not my client yet. What else? That's the main thing. There's a lot of disruption happening this year. There's a lot of changes. There's been changes the last few years, but for some reason this year, everyone in the industry, in these Facebook groups that I'm part of with the Medicare agents, is freaking out about, a lot of plans are becoming non-commissionable, meaning they're no longer paying agents to sell them. And that's nothing to freak out about. The reason is that they're trying to kind of veer people toward a different plan. And, that's not really like malicious or anything. They're just, these are companies that need to make money too. So it's not, I just think we need to not worry so much. The plans change and we make adjustments. We don't know what's going to happen in 10 years. Like, no one does. We don't know. I've been hearing since I was a little kid that Social Security is going to go away by the time I'm old enough to enjoy it. So who knows? But for this year, I'm happy to help you make the best choice for you. So we'll go over the options, what they entail, and we'll come up with a plan. So that's my very wordy, disorganized statement on what's happening in Medicare. Again, there's no cost or obligation for meeting with me. So my calendar does fill up fast. I am a full-time nurse and a mom and a author and, coach and creator. So I'm working on a lot of things, but this is very important to me. And this business has been the business that chases me. And I am determined to teach people how to have Medicare moxie. That's my little catchphrase. I'm working on the book maybe by that title. I'm working on a course and a program. So I'd love to help you, empower you, and help you to understand how it all works so that you can make the best choice for you. All right. Thank you. And I'd like to hear from you soon.